That is the thing that I think the public needs to understand is the goal of flattening the curve. We may not save lives in the immediate, but the longer you have in your hospital to take care of a patient, and the more you're not overwhelmed, the better chances you have of saving lives. I mean, that is the whole point of this, and I think people don't understand it. This isn't going to cure the disease. This just buys you time in your hospital.
Correct. And, I'm often asked, what can we do to help the staff in the emergency room? And there are a few things. I mean, we've heard about the distancing. We've heard about washing your hands. And the other thing is basically knowing when to come to the emergency room. Remember, at this time, at the date of this recording, there is no treatment for this virus that has been proven. There is no vaccine. So essentially, you want to come to the emergency room if there's something we can do to help you. You may have a fever. You can stay at home for that. You may feel really miserable. Try to gut that out at home. But what we can do for you here is if you're really struggling to breathe a lot, we can give you oxygen. Right. And in worst case situations, we can put you on a ventilator. So a lot of it's just knowing when to come in and when not to come in because people are scared and people are afraid. So again,
I'll tell you what's
trust your immune system.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.